Dressing individuals appropriately for weather conditions and hypothermic conditions is your CNA monthly training for December 2023. Helping to keep staff and individuals served at CHDC safe is a priority. Therefore, we have provided some tips to remember when assisting with dressing an individual for their daily routine. CNA reminder. Staff must ensure to wear suitable footwear such as shoes that are fitted, slip resistant, and sturdy in order to prevent any falls when caring for the individual served. CNA tips. Making an individual feel comfortable while dressing them is important. Be polite, patient, and respectful to individuals during the dressing, undressing process, and at all times. Be careful not to pull or push individuals to avoid discomfort and pain. Communicate with individuals and let them know what you are going to be doing to ensure their comfort level. For example, I am going to put your socks on your feet. Give the individual clothing choices to promote a feeling of independence. Provide no more than 3 items at a time to prevent overwhelming the individual. Protect individuals' privacy by closing doors and curtains. Provide a warm enough room to get undressed and dressed. Encouraging the individuals to dress and undress themselves with verbal prompts and provide assistance when needed. Keep clothing items close or in reach of the individual to avoid difficulty. Recommend adaptable clothing when dressing becomes a challenge to their independence or a struggle for both the caregiver and the individual in order to make dressing easier. Be aware of fall risks and help prevent individuals from falling when dressing. Individuals should be in a seated position when getting dressed to avoid falling or losing balance. Be observant to individuals' gait, strength, and balance to help determine if poor balance and weakened leg strength. Ensure proper footwear is being worn properly and is in good condition. Muscle contractures. Dressing an individual with muscle contractures or paralysis can be difficult. The clothing should have large openings, Velcro closures, open back, and elastic materials to make it easier in dressing an individual. Adaptable clothing helps eliminate the need to lift or twist the arms in ways that can be painful or uncomfortable. When an individual has contractures on one side and not the other, then staff must always start dressing an individual on the contracture side first to prevent injuries of the extremities. Ensure individuals are dressed appropriately for the weather. Assist individuals in wearing winter clothing inside and outerwear when leaving the residence. Example: hats, ear covering, gloves, coat, boots, etc. Encourage individuals not to partake in outdoor activities for an extended period of time. Offer warm fluids, beverages to individuals during the winter months. Hypothermia. Hypothermia is defined as a body core temperature below 95 degrees Fahrenheit in humans. Staff at CHDC will follow required procedures for hypothermia if an individual's temperature is at or below 97 degrees Fahrenheit. If your body core temperature drops just a few degrees, hypothermia will set in. With even mild hypothermia, your brain and body do not work as well. Severe hypothermia can lead to death. The key to staying safe in the cold is to wear several layers of clothing. Preventing hypothermia. Monitor residents to ensure adequate temperature is appropriate for the individuals served. Dress individuals in layers instead of one thick layer of clothing, since layers provide better insulation. Avoid tight clothing as it reduces blood circulation. Replace wet or damp clothing as soon as possible during winter months. Preventing hypothermia. Place hats, gloves, and scarves on the individuals. Forgetting scarves around individuals' neck can cause the loss of heat through their neck. Avoid unnecessary exposure of any part of the body to the cold. Provide warm blankets by placing them in the dryer for a few minutes. Apply gradually to the center of the body, neck, chest, and groin area. Do not start with warming the arms and legs because that can force cold blood back toward the center of the body and can cause the core temperature to drop. which could cause death. Causes of hypothermia. Certain medical conditions such as diabetes and thyroid conditions, some medications, emotional upset, or using drugs or alcohol can cause hypothermia. Exposure to a cold environment, age, body mass, body fat, and overall health can cause hypothermia. Hypothalamus. Hypothalamus is the part of your brain that produces hormones that control body temperature, heart rate, hunger, and mood. When you are cold, shivering is a way to produce heat through muscle activity. In another heat-preserving response called vasoconstriction, blood vessels temporarily narrow. The hypothalamus' main job is to maintain internal balance within your body. Normally, the activity of the heart and liver make most of your body heat. But as core body temperature cools, organs produce less heat, causing a protective shutdown to preserve heat and protect the brain. Low body temperature can slow brain activity, breathing, and heart rate. Confusion and fatigue can set in, and you may not understand what's happening or be able to get yourself to safety. Hypothermic observation. Contact the nurse on duty if an individual's temperature is 97 degrees or below and complete an observation form. Contact the nurse on duty if an individual displays symptoms of hypothermia such as shivering, fatigue, drowsiness, numbness, blue skin, slurred speech, glassy stare, irregular pulse, decreased level of consciousness, etc., and complete an observation form. Purchasing clothes for individuals. Contact the social worker to complete a purchase order if an individual needs clothing items for the winter. Contact the clothing room if an individual is in need of winter clothing items with limited funds in their account. Thank you for providing quality care to the individuals served at CHDC. Please continue to show compassion, kindness, patience, and respect. The end.